Well, I'm Shel McAvoy, and I'm a member of the First Unitarian Church in Oklahoma City. And in 2000, I became self-employed and divorced, which threw me pretty much into a tailspin of dealing with health insurance companies to get health insurance coverage for myself, which was quite interesting, to say the least. They would cover you for a year at a low premium, and then after that, they would raise you. So you had to play this gambit of back and forth, back and forth. And of course, then you have no provisions for previous, excuse me, for previous conditions, and so it was a lot of work, and a lot of filling out paperwork, and all that kind of stuff. So finally, I reached a point where I was at a premium of $350 a month, with a $4,500 deductible, which to me is like a car payment, So it's pretty extravagant and daunting, to say the least. And that was only covering me for major medical illnesses only. So that was only for hospital care in case of a catastrophic illness. So in Oklahoma, it became available to those of us that are self-employed through a Medicaid-funded, federal-funded program called Insure Oklahoma that would provide health insurance coverage for self-employed people, and also employers to cover their employees. But the qualifications are pretty limiting, but fortunately I was able to qualify. So that was a big relief for me, not only financially, but mentally. So with the governor, and it makes it also something available for those of us who work. We're not lazy people. We want to work and provide. So with the governor not wanting to expand Medicaid expansion in Oklahoma, in 2014, the Insure Oklahoma program will end. And that means a lot of us that are on this Insure Oklahoma plan will not have health care insurance anymore. And that can be pretty daunting. And that affects a lot of us who work. So without the funding and no health insurance, it affects a lot of people who want to work.